We're now going to start with our first general session of the day, hearing about the latest data and information from the economic impact of early care and learning in Alaska. To introduce that session, as I said, I'm the guy that introduces the people that you're actually here to see. Please welcome to the stage the State of Alaska Department of Health and Social Services Commissioner Adam Crum.
Good morning. So Stephanie should know better. As somebody who works with children, you can't tell people that you can unclick something and that there's something valuable there. Did anybody notice no one paid attention after that? My name's Adam Crum, so I'm the Commissioner of Health and Social Services, and it is a pleasure to be here. We're sponsored this summit through Division of Public Assistance, the Child Care Protective Office, and the Child Care Resource Referral Grant to THRED. I'm also the co-chair of the Alaska Early Childhood Coordinating Council with Commissioner Johnson of DEED. So sitting in those meetings, there's a lot of passionate people that sit around the room, and we have to listen to very engaging, eye-opening reports. Learning more about this subject, I just spent 2 weeks ago down with the Administration of Children and Families, meeting a region administrator of 8 with new health secretaries down in Denver. Part of this is we were talking about the long-term effects of early childhood education, learning more about how to work with our federal partners and how to actually bring that back home. In a month, I'll be going down to Seattle area. Region 10 just has a new administrator just assigned as well for ACF. So this would be interesting to learn how that works. But the impact of how the early childhood stuff affects everything else that my department does is becoming more and more prevalent the longer I'm in this job. We've actually had a conversation just a couple weeks ago that was facilitated by the governor and a couple cabinet members about public safety. He started off the meeting by talking about the ability of children to read by 3rd grade actually predicates a lot whether or not they'll enter the criminal justice system later in life. When you talk about public safety and then the importance of reading at a young age, that really tells you how this is the keystone to affect everything else. One of the things I tell my staff is that we need to work better towards those outcomes. If we work towards family resiliency with OCS, getting family the support they need, then they actually don't hit our other business lines. We don't want them to be customers in the other things that we offer. We want them to have opportunities to grow and to thrive. And so thank you all for coming together on this, because this is not something that we can solve at our level. This has to be solved at the local level with hands-on, dedicated work and passionate drive. So thank you all very much. Speaking of that then, it is my pleasure to introduce today's first general session, a presentation on the latest economic impact of early care and learning in Alaska. The AECCC has been supporting this economic impact data since 2015. Data from the new economic report from McDowell Group, coupled with ACT and the Kids Count work, helps to facilitate the integration and alignment of services, supports our planning efforts, resources, and policy development, ultimately strengthening our supports to children and families. We'll hear from 2 speakers this morning, followed by time for Q&A. So please join me in welcoming Jim Calvin, Principal at the McDowell Group, and Trevor Storrs, President and CEO of the Alaska Children's Trust. I can't run away from Trevor, I'll get in trouble.
Good to see you, sir.
Good morning, everyone. My name is Jim Calvin. I'm principal with the McDowell Group. I'd first like to offer my thanks to THRED for making this really important summit a reality. We feel that it's our privilege, it's our honor to have had the opportunity to work with Stephanie and her crew at THRED, and really everyone that's devotes so much time and energy into improving early care and learning in Alaska. We hope that in some small way, McDowell Group's effort to bring the economics of early care and learning to light, to do the research, to communicate our findings, we hope that in some small way that's helping with this really critical effort to improve access, improve quality, and just do much more for our young children. Before I get started, let me introduce the other McDowell Group folks in the room. Here seated in front of me, Katie Berry, Wendy Cannonberg, Kirsten Sheldon. These folks have all been deeply involved in our early care and learning research and analysis. I'm eternally grateful to have such powerful professionals on the McDowell Group team. I'd like to thank you all very, very much for all your hard work and your dedication to this project and all that we do at McDowell Group, so thank you. So let's talk economics, or try to. So we've been busy at McDowell Group here over the last 12 months. Actually, we've been at this since 2005, but we've had quite the suite of projects working with Stephanie and her crew at Thread. We've updated our economic impact analysis. We've developed a model over the years that allows us to get the latest data, put it into the model, and help us understand what the wage impacts are, the employment impacts, and so forth. So we'll talk a little bit more about that momentarily. We conducted our third parent survey, statewide parent survey. Something new this year was a sort of a deep dive into the early care and learning labor force, learning all we can about who these people are, what they're earning, what their employment situation is. At the moment, we're in the middle of a national scan of early care and learning practices by employers. These are progressive employers, and some of the tools and policies and procedures that they've put in place to be supportive of their employees with parents. So we'll talk more about that. That's really interesting work. We're about to kick off a survey of Alaska employers to gain their impressions about early care and learning, their experience with parents in their workforce, and what their perceptions are about the importance of public investment in early care and learning. Again, we'll talk more about that. And as some of you may know, we've developed a data dashboard on all things related to early care and learning. I think that's about two years ago we developed that, 18 months. In any case, new data, we're working on an update of that and a new and improved version of the dashboard. So let's back up here and just sort of talk about who it is we're trying to serve with this early care and in this early care and learning world. There are 86,000 children in Alaska under 13 years of age in households where all available parents are in the workforce. All available adults are in the workforce. They reside in 55,000 households. If you include parents who are at home but are unable to join the labor force or to be fully engaged in the labor force, we count about 100,000 Alaskan children in need of care. That's a big slice of our population. What Alaska is at 750,000 residents. So this is really a fundamentally important thing to our state that affects thousands and thousands of children and thousands of households and families. Let's first talk about our parent survey. As I said, we've done 3 of these. First one in 2006, another one in 2015, and then most recently conducted a survey in April and May of 2019. We surveyed 868 randomly selected households, families with children in Alaska. Those households had over 1,600 children. And the survey, that's a big sample size, really robust sample. It has a high, very, very low margin of error, high statistical reliability. It represents 84,000 Alaska households with 62,000 children under 6 and 75,000 children from 6 to 12. We did the survey, as I noted, in April and May. It was about early care and learning services, use, costs, et cetera, in the month of March, again, consistent with our previous survey research. As I noted, this is our third, so we have some capacity to track trends over time. I'll talk a little bit more about that as we go. We did some extra surveys in urban areas, in Mat-Su, Fairbanks, and Juneau, and with that prepared sort of supplemental profiles of the early care and learning world in those larger communities, which accounts for most of the state's population. Our survey research slices and dices the data a lot of different ways, including very small rural areas and the conditions there, somewhat larger but largely rural areas, and then the urban areas. So lots of data in the survey research. For those of you that are interested in diving into the data, let us know. We've got plenty to work with. So here's some of the key findings. Again, mountains of data come from our survey research. Just want to touch very quickly on some of the key points. One is that our survey research indicates that just over half, about 52% of children under 6 are typically in receiving care in some sort of an ECL service. They are in care for an average of 105 hours a month, and among those that pay for that care, the average monthly payment is $652. The hours in care with this survey is pretty close to what it was in 2015 when the average was 102 hours, so no real change there. The cost per month on average in 2015 was $582, so costs are up. Again, no big surprise there. Keep in mind that that $652 a month may look low, but that's an average of children in part-time care, full-time care. It's an average of infants and 5-year-olds, so the costs range widely across that spectrum and around the state as well. Found that 30% of children aged 6 to 12 are typically in care. They're in care for an average of 47 hours a month, and parents are paying about an average of $319 a month for that care. As I noted, those are statewide averages. It's highly variable across the state, and again, our report will provide some of the details in that regard. Another important finding from our survey research, among the parents that have children in care, 57% reported that they found it difficult or very difficult to find that care. It's the usual culprits. It's just there's no slots available for their children. There's a lack of providers. It's the cost. It's the quality. Availability is the main issue that parents are pointing to. Sort of a disappointing trend in this regard. Our previous survey research found that about 46% of parents had reported that it was difficult or very difficult to find care. So evidently it's getting more difficult for parents to find the care that they need, care in terms of just availability, care in terms of cost, care in terms of quality. So not a good trend there. Another key finding, again, all of this has economic connections, but found that 1 in 5 households, 1 in 5 family households reported that at least one member is not able to join the labor force or work as much as they would like to because of lack of access to early care and learning. That has really profound implications on abilities for families to generate income and improve their standard of living. One of the primary benefits, as I'll report momentarily, of quality early care and learning, availability of early care and learning, is it allows parents to go to work, earn income, improve standard of living for their family. 1 in 5 families are unable to fully realize that benefit. Again, cost, availability, quality are all noted. In this instance, cost was the primary reason that parents are unable to work as fully as they would like to. Let's talk a little bit about economic impacts. It's the spending that actually facilitates the creation of jobs and wages and multiplier effects. We measured about $375 million in total spending this year. That's the direct expenditure on providing on services, what parents pay. We measured $215 million in household spending, $115 million in federal government spending, $44 million in state and tribal spending. The deck has been shuffled a little bit from 2015. We found that in 2015, households accounted for about $223 million in spending, so the amount of spending has dipped a little bit, but it's not a big change, so we're not putting a whole lot of stock in that, but there's some sort of a trend at work here. Federal spending is up a fair bit. It was $84 million in 2015, seeing $115 million, so that's a good sign. Increase in federal spending. State and tribal spending also up a bit. We measured $36 million in spending with our last research. So a new deck total spending in 2015 was $343 million, up to $375. So a bit of an uptick. Inflation eats most of that, so it's all in all, it's not a great improvement in terms of total investment. One of the key take-home points here from this data is that households continue to bear most of the cost burden for early care and learning in Alaska. That spending translates, according to our model, we have industry in quotation marks because people often don't think of early care and learning as an industry. Well, it is. It's a very legitimate, very important part of our economy in Alaska. We can measure about 6,900 direct jobs connected with early care and learning in Alaska. If you think about the multiplier effects, it's that $375 million circling through the economy. There's indirect impacts, there's induced impacts. We count about 8,200 jobs. That is above what we measured last time. We measured 7,700 jobs total, including all the multiplier effects in 2015. We're not ready to say that the industry is growing. Part of our challenge is it's really difficult to measure a lot of the income and employment activity in that informal part of the early care and learning world, so we model that. But nevertheless, we're showing 8,200 jobs compared to 7,700 jobs previously. We identify $186 million in direct labor income and wages to the people that are employed in early care and learning. Multiplier effects ratchet that up to about $260 million in total labor income all across the state. As I noted, that direct spend is $375 million. If you roll in all the multiplier effects, it's about $565 million in total economic impact. So this is a $500 million plus part of our economy. So it's a big thing. Just at face value, as you typically measure in industry, $500 million economic footprint. But that may not even be the most important part of the economic impact of early care and learning and availability of early care and learning. There are 52,000 Alaskans who are able to go to work because they have access to early care and learning services. Those 52,000 Alaskans earn $2.2 billion in annual wages. So because families have access to early care and learning, they're able to earn much higher household income, family income than they would otherwise, enjoy a much higher standard of living. So this is really an important part of the economic picture associated with early care and learning. And recall I said about 1 in 5 families are unable to work as fully as they would like to. This number could be substantially bigger if not for the barriers to access to early care and learning. As I noted, we did a deep dive into the early care and learning workforce, gathered all the data we could find that helped us understand who the workers are, how much they're making, how long they work, that sort of thing. Really interesting results from that. No big surprises, I don't think. We found that early care and early childhood educators earn an average monthly wage of about $1,845. That's less than we pay gas station attendants. That's less than we pay grocery store clerks. It's well below, less than half of the private sector average of over $4,300. So those folks that we give big responsibilities to are among the lowest paid workers in the economy. And if you look at the national data, you can see that at face value, Alaska employees in early care and learning are earning about the same hourly rate as the national average. But you factor in cost of living, which typically, all other things being equal, is about 20% higher in Alaska than the rest of the country. Our early care and learning workforce is actually earning less than the national average in terms of purchasing power. Really interesting analysis with the help of the Alaska Department of Labor Research and Analysis Division. We tracked to understand turnover in the early care and learning workforce. We tracked a cohort of employees through a several-year period. In particular, we looked at everyone that was employed in 2015 in early care and learning and jobs that had been reported to the Department of Labor, which isn't everybody, but it's a pretty big chunk. Of those that were employed in 2015, by 2016, the next year, 43% were no longer with that same employer. And 2 years later, in 2017, 62% had moved on to a different employer. So huge turnover. And also, as you might expect, with low wages, people are required or need often to find a second job. Among employees in early care and learning in 2017, over a third, 37%, worked a second job as well. So why is this important? Well, why is this low wage situation important? Obviously, it results in really high turnover. And providers have a really hard time recruiting and retaining employees with these low wages. And if you have high turnover, you have trouble retaining employees, that presents real challenges in terms of continuity of care, which is an important part of the quality equation for early care and learning. So our challenge is just to somehow, as I noted, we give these caregivers and early educators huge responsibility, and we pay them right at the bottom of the pay scale in Alaska. Somehow we have to align our public and private, mainly public investment to balance that. piece of research that is underway right now, as I noted, is a national scan of some best practices by employers as they develop policies and programs and benefits for their employees who are parents. We found that these kind of things sort of fall into four boxes. One is sort of financial support, another is just providing child care. There are some organizational culture and policy provisions, and then there's a broad range of sort of flexibility policies that employers use. Again, we've looked all across the country to identify this isn't, what we'll talk about isn't the norm. This is what some of the more progressive companies are doing to support their parents who are their employees, and the benefits that these businesses, that these employers enjoy because of these policies. We've got kind of a long list that we'll go through pretty quickly, but some of the financial supports that employers provide just include, dependent care assistance plans, vouchers to pay for care, scholarships for children, et cetera. Baby bonding bucks was like a one-time payment when someone has a child. Paying healthcare premiums, insurance premiums, of course, is a really fundamental one. Financial assistance for adoptive parents. So some really interesting and really creative, really innovative things that employers, some employers, not many, some employers are doing across the country to provide financial supports for parents. As I noted, another one of these boxes is just providing child care. Some, again, not many actually have on-site child care. Others provide child care resource referral information. They have babies at work policies, they have children at work policies, even one employer that actually provided traveling caregivers for their employees when on a business trip, and providing child care for school-age children during the summer. So again, some employers are being really forward-thinking and being really aggressive about making their businesses, their organizations, an attractive place for parents to work. Some of the organizational culture and policy kinds of things that we see are interesting. One is a meeting time policy, for example, which in this company, they don't schedule any meetings before 9:30 or after 4:30, those typical times when parents need to go out and pick up children or drop off children, pick up children. There can be just a company philosophy around encouraging supervisors to support employees with families, providing suitable space for nursing mothers and offering flexibility whenever and wherever possible. In that regard, there's a long list of things that we've seen in terms of being flexible for parents' start time and end time over the course of the day, working compressed weeks, shorter weeks, more compressed weeks, allowing new parents to sort of gradually return to work rather than going from nothing to back to 8 hours a day, taking extended breaks to care for family members. A long list of ways that employers are finding it's to their benefit to support their employees with this kind of flexibility. And one of the key ones is allowing parents to take some extended breaks and come back without suffering any kind of career path repercussions. And what these employers tell us about the benefits of offering these kind of policies to their employees who are parents, they've reported increased productivity and organizational performance. One even reported that their stock price went up. Company reputation is improved. They have a competitive advantage when recruiting employees, lower absenteeism, lower turnover, increased engagement and trust, more women in management positions, and even some are saying, we invest in this, but we find that investment is either cost neutral or it pays for itself. That's a really important part of the message from this research. Okay, I'll start to wrap up here. Some of the key messages from this suite of research, not all good news for sure. One is that access to quality care evidently is getting more difficult. Parents are having a harder time finding care. As I noted, there's one in five families out there who still are not able to work to the extent that they would like to. They either can't work at all because the cost or quality or access just isn't there, or they're not able to work as much as they would like to. So big barriers for families to earn income and improve their standard of living. As I noted, families continue to bear the burden of most of the cost of early care and learning. Imagine if families were asked to bear 60% of the cost of K through 12 education. It's just a non-starter. But that's where we are with early care and learning. And ECL wages remain among the lowest in the economy. That's just a fundamental disconnect that we need to invest public resources to shift that really difficult aspect of the early care and learning sector. As I noted, we have to, part of the message that we try and communicate is there's strong return on investment in early care and learning. Again, greater investment allows more parents to work and earn more income and improve the standard of living for their families. Greater investment in early care and learning and will enhance workforce recruitment and retention. And in doing so will allow for an improved quality of programs. It will increase school readiness, which we know has important educational benefits throughout K through 12 education. And there's a growing body of national research that just shows how important quality early care and learning is, especially for disadvantaged children in just overall lifetime achievement in terms of education, in terms of employment, in terms of health care, in terms of staying out of the criminal justice system. So upshot is it's a great investment. Our challenge is to continue to try and educate policymakers and others that it's a smart investment, and we need to get with it. I'll conclude with an update on what we're up to. One is the Alaska Employer Survey, which we're going to launch here later this month. We're going to ask for everyone's assistance on this survey effort. It's going to be an online survey. We want as many employers in Alaska to participate in this survey effort. We're going to be designing the survey instrument here over the next couple weeks, so watch sometimes towards the end of October for some email traffic with links to the survey. Please encourage your employers or others to participate in this really important survey effort. We want to ask what Alaska employers are doing with respect to supporting employees. We want to ask them what barriers they perceive that prevent them from being more supportive of employers. We want to understand what the typical businessman thinks about further public investment in early care and learning in Alaska. Watch for final reports of the survey research. We have drafts that are out there now, but we haven't made those widely available. We're still fine-tuning some of the data there. So watch for a full revised report of the parent survey. Watch for a final version of the workforce profile document. All really interesting stuff. And watch for a final version of this. I think this is on this brochure. It summarizes all of the research that we've been engaged in. This is a draft. We're going to roll in some of what we learned in the employer survey into this. We want this to have legs. We want it to be a useful tool for several years. If you have thoughts on how to improve the message that you hear, anything that you think is confusing or if we could just clarify the message better, please don't hesitate to let us know. There's several McDowell folks here. Grab us and say, hey, you know what, I don't understand this. That really helps us will help us make this a really effective document that we can use for several years to, again, educate the world about the economic importance of quality early care and learning. And I think that's it. And we're doing questions later, I think. So thank you all very much for your attention.
Good morning. Now, is this a challenge? 9 a.m. I think I heard someone said we ran out of coffee for a moment, and you have to sit there and listen to numbers. So we'll try to perk things up and keep you all awake. Are we going to put my presentation up, or do I just do the song and dance? Well, song and dance. You don't want me to sing, but I don't dance well. As they pull that up, Trevor Storrs with Alaska Children's Trust, and we'll be talking about how are our kids doing, and this is related to Kids Count data. Kids Count is a partnership with the Annie E. Casey Foundation. They are a national foundation. There's a Kids Count in every state. We don't create the data. The whole idea of Kids Count is bringing all the different data sources that are related to kids and families and try to centralize it. I'm up here speaking about it, but really the man behind the curtain that does all of our work and so forth is over there. Please stand up, Andrew Cutting. He's our senior fellow that does this work. So if you ask really technical questions, I will be waiting for a text from Andrew, so there will be a pause. All right, and I have the power. Let's see if I press it right. So as I speak today, we have a vast number of data sources. These are just some of them. We may be missing some just listed. We use all kinds of sources. One of the things also to mention, it's great to be up here with McDowell Group because most of our Kids Count data, booklets and so forth that we've been putting out has been through a partnership with McDowell Group, and it's great to be presenting with them as a partner. So how are our kids doing? They're ready to soar, but they're walking a very fine tightrope. We're 45th in the nation for child well-being. Just so you know, being 50th is not first place. We're 45th. And if you look at this graph, 5 years ago, we were 27th. So, are we getting worse? Not necessarily. What is happening, though, is other states are utilizing data. Revolutionary, folks. They're using data and realizing kids aren't doing well, what do we need to do? And using this to not only start the conversations, but to hone in where they can make the most difference and start making sure that their children thrive and the families have the support, the knowledge, and the access to services so they can provide for their kids. Kids Count breaks things in 4 areas: family and community, education, economic well-being, and in health. You can see where we rank in each one of those. And then it's further broken down into specific categories and areas. So what's going on? This is a family member pushing that boulder up and what they're facing. Why aren't our kids doing well? We look at healthcare costs and access, high housing burden, food insecurity. We just talked about early childcare and the challenges there. Low income, lack of transportation, and these are just a few. When you put these things in front of a family and say, you're on your own, push that boulder up the hill, there's a reason why some of our families are really thin, because they get bolded over by that and flattened out. That was funny. Laugh. Work with me. Stay awake. Stay awake. Start talking about kids. Let's talk about who those kids are in Alaska. So we just have over 200,000 kids in Alaska, age 17 and down. This breaks down age groups. 0 to 4, 5 to 11 is our largest group, 5 to 11. And of course, that changes. And I do want to preface, some of our data is not as in 2019 or 2018. Because of data sources, unfortunately, it doesn't come out immediately as they collect it. And these can vary depending on the year and when things are available. So you might see a little bit of difference if I share something that what McDowell Group just shared. Where are the populations here in Alaska? So of course, not a surprise, #1 urban center has about 40% of our children and youth, and it's broken down there. And this is from 0 to 19. Again, it also depends on the data source we get. People define things differently. I think any data person would love if those people would get together and actually have common definitions. Anything to make it challenging. Family migration is really important. So where are we seeing changes? We've all heard Mat-Su is the fastest growing community in our state and at times has been in the nation. So who is going there? Because we're seeing a drop. But it's really important when you look at data, I challenge you to always unpack it. This is high level. Go down a little deeper. So you'll see here in Anchorage, white families down by 17%. But look at Asian, Native Hawaiian, Pacific Islanders increased by 78%. And other people and minorities have increased. You see white decreasing in other areas, and then you see Matsu. It shows that people are leaving Anchorage, white families moving out to Matsu for a variety of reasons, and it's usually because they couldn't afford a house here. And you'll see that, again, white people could actually afford a house, but to afford it, they had to go to the Matsu. So that's where we've seen the major increase. Unpacking data tells you a lot. Income inequalities. Median family income, $75,500. Sounds pretty good. But when you take out white families, it drops down to $48,700. Huge difference. And again, unpacking this and understanding disparities. So when we start looking at other numbers and seeing where families are struggling and who those families are, unpacking the data, seeing where the income inequalities, and helping leadership understand these data is really important. Because they're like, well, I'm making money. Those jobs exist. Well, only maybe for certain families. Dual income. 68% married couples, 32 are single families. And of those 32%, majority of them are housed by women. And we know the pay gap, inequality that exists, not gap, inequality. Women are making pennies to the dollar compared to men. Huge impact. And then you get into the cost of childcare. Teen birth rate. These are our young families or young individuals having kids. We've been seeing a drop on a national level and here in our state. But still, national average is around 18 to 19%, give or take. We're still above that. 18 to 19-year-olds, that's a huge rate. If they've been lucky enough to graduate high school, hopefully maybe being in a dual income, but most of them aren't. And they're at their starting point of income. They're not at that 75.5 median income, not even close. And again, we're now talking about costs of services like childcare. Huge impact. And again, unpacking it, where are these teen births occurring? Northern, 71%. Southwest. So part of this, and a part of the role of even looking at childcare, is even having discussions about human development, family planning, spacing out, birth space, very key. Plays into the role of being able to afford childcare, dealing with poverty, number of things, health. Uninsured rate. National average is 5%. Of course, Alaska always has to go for number one in something. We're number one, we're double, we're at 10%. And this is the breakdown. Get my good side, please. I actually want to see the cartoon character that the artist does of me. That's what I'm excited about. Developmental checklist, 3-year-olds, really important. And we should be proud, 82, 72, you see these high numbers. There are a couple low numbers, but even 80%, 20% of kids are missing. It's such a key time. 0 to 3, 0 to 5, most of the brain development. We need our kids to be checked because if we can catch things early, their success opens up. And for those economists in the room or people that are worried about the bottom line, we save endless amounts of dollars. We know that. I don't need to show you that graph from Heckman. Pre-K enrollment, where it's happening. Some places are doing well, other places are struggling. Preschool enrollment. Yeah. We should be seeing close to 100%. Thank you to those advocates in the room that fought for those dollars. But let's be honest, we fought for pennies. We need to fight for more. And I know there's representatives in this room. I was sitting next to one. I just want to personally say thanks to the representatives that didn't need to be convinced that this was important, knew it, and have been fighting for it, and are continuing to do it. So thank you. Child death rate. We're in the United States of America. We shouldn't be seeing numbers like this. You're going to be probably asking me at some point what's causing the death rates, and I will direct you to the expert, Dr. Jared Parrish, to break that down. Struggling families. This is children who live in families with an income below federal poverty level. So 36% of children live in families below poverty level. Does anybody know what the amount of the federal poverty level for a single family is as of 2019? What amount of money do you need to be earning, at or below? I don't have a prize, but take a stab. No, family of one person. Lower. 12,500. $12,500. Let that sink in as a single individual. Now go with a family of 4. You're getting closer, Representative. It's $25,750. Live off of that. Take a pause. Think of what that Starbucks cost me. Think about the cost of childcare. Basically $28,000 a family of 4. I don't think I need to say anything else. Housing. It's a basic need. It's not a luxury. To be able to afford a 2-bedroom at fair market rate, you need to be earning $24.10 an hour to only work 40 hours. So if you're working at minimum wage, we'll just say $10 for kicks, or between 10 and 12 for some. You're working at Fred Meyer's because you're not a child care provider because they don't pay enough. You have to be working 2 jobs, or you have to have 2 people working. And then you got both family members working. How are you going to afford child care? $24, if you times that by 2,000, we're talking that's about 50,000. And if you're a family of 4, that's just only double the federal poverty level. It's not much. But let's break it down even further. The Aleutians, you need to be making just under $33. I'm sure there's tons of those jobs there, tons. Nome, Denali, Juneau, you can see. Here in Anchorage, it's around $21, $22 an hour. That's $47,000 a year. We don't have enough of those jobs. So $9.80 hourly minimum wage. It's about $9.89 now. You have to work about 77 hours to be able to just get into a modest 1-bedroom. Further breaking it down, just looking at it, minimum wage, then you have the average renter's wage, 2-bedroom housing wage. There's a reason why we have a homeless problem. And I'm not talking about the individuals who are struggling with substance use and, more importantly, struggling with their trauma, and that's why they're there. That's a different day, different conversation. But it's the families we don't see, because they're trying to work those 2-3 jobs so they can maybe afford an apartment or a couch surfing with families. And then you have landlords going, 2 families can't live in there. It's too many people. And they have to go. Sometimes our systems perpetuate the problem versus prevent. Family hunger. 20% of Alaskans' children live in homes without enough food. Make sure your plates are clean this afternoon when you eat lunch, because 20% of kids aren't getting it. We are one of 11 states that have not dealt with school food debt. Kids get different meals at times, get less food because they owe money for lunch because the parents can't afford it. Because they're at federal poverty level, they only have $25,000. As I mentioned, the cumulative stressors. I just talked about them. Imagine all of those, every single one of those in front of you. And I look in this room, that boulder gets bigger and bigger depending on race, the color of your skin, your age, and all that also impacts level of education. All of those things just start building up. That boulder even gets bigger. And why does things happen to our families? Because that boulder is so big they can't push it or let alone even hold it back, and it literally goes over them. So what is our job? Blow that thing up. Stick some dynamite in it. Get rid of it. We need to be looking at workforce development. We need to be having serious conversations about education, housing, social supports, early child care. I learned 2 days ago by our MC, the one department that saw a increase in budget. Anybody that was there can't answer. Jonathan can't answer. What was that one department? Corrections. We're giving money so we can put people away and ignore them, and everybody else is getting cut. And we know, again, the data tells us, early childhood, we start investing early, we can change that. So I'm on a soapbox. We advocated once, we're going to have to even advocate harder. We need to make sure we're giving a voice to those who don't. And I know I'm going to a little bit off script. You just wanted data, but I'm not just going to give you that. I'm going to give you some background. Again, these are our numbers. One of the things that I also did not share, and I'm looking in the audience and I'm realizing it, we also have an amazing partnership. Just so you know, like I said, this data isn't ours. We have an amazing partnership. I listed them, but they're bigger than what's on that list is the Department of Health and Social Services. I appreciate them. They're in the room. They take care of our data center. They actually help screen some of this data, help us understand it, and so forth. And my apologies not recognizing. I'm looking at, I'm like, oh. So let's hear it for the Department of Health. They do amazing data. And I'm calling that out because our legislators need to know it as well. They have a resource internal and they don't use it, or they sometimes don't believe it. They're the most unbiased, heartfelt individuals. So I encourage our legislators and leaders to actually look to our state for amazing data. Hope I don't get you in trouble for that. All right, so these are some of our resources. You can check it out. There are different reports on kids count, fancy pictures, all that kind of fun stuff. Want to recognize key funders, NEKC Foundation, Rasmussen Invest in this work specifically, comes out with reports as well as there's national reports available. And if you ever need anything, you can ask, connect with us, connect with Andrew. You need data. We might not know it, but we know people that do. We can help you with that. This data will help you provide services, help you advocate, and most importantly, help our families get what they need. Thank you.
And let's step into Q&A. So the first question here is for Trevor, which is, where do you see the biggest opportunity to change the statistics of children's well-being? Is it poverty, health, inequality, education? Where is it?
So we always talk about trying to go as far upstream as possible, Alaskan style, that we stop the glacier from melting. So obviously, we've already talked about the investment in early childhood, but I think one of the areas through the work of Dr. Jared Parrish and the data that he's been doing with AtLink and so forth, it's really clear that one of the areas that we need to be investing in is our teens, specifically around healthy relationships. Developing those healthy relationships at such a young age, one, ensures that we reduce some of the trauma that they experience if there's any dating violence or anything of that nature, but they start developing healthy relationships. So one, indirectly it starts doing appropriate family planning, as well as when they become parents, they're in the healthier relationships that they can ensure that they can helpfully raise the kids, as well as through healthy relationships, they determine when they need to get into relationships, which can greatly ensure that especially women finish school, get high school, and then go on for further education, so they don't find themselves just working the $10 or $12 hour jobs, but can actually work in an occupation and hopefully make that $24 an hour that they need just to work 40 hours.
Okay. Our next question is for Jim. Jim, you know, one of the benefits of having McDowell do this survey for so many years is that you've been able to see the trends in the data. You know, why do you think access and availability is getting worse? We're seeing that trend in the data where it's getting harder to find childcare. What do you think is going on there?
I think it's the result of the very difficult business model that we ask of early care and providers. It's, in many respects, early care and learning from a private sector perspective is a market failure. There just isn't the revenue. Parents can't afford to pay more than they already pay. Employers can't afford to pay their people more than they already pay. The result is it's just a really hard industry to make a buck. It's just not there's just limited or zero capacity for profit motive in this part of the economy. That's called a market failure, and that is why it's so important that there be more public investment in this. Again, it's this, imagine again the world with parents paying the full 60% of the cost of K through 12 education. It would fail. There isn't the capacity. Parents don't have the capacity to pay the revenue, pay the cost that's needed for a private sector early care and learning provider to pay their staff a wage that is a living wage, a wage that supports career development, career path. So I think it's a broken business model. And fewer providers are willing to give it a try.
Right. Thank you for that answer. So the next question is, 22% of adults cannot participate in the labor force or work less than they would like to because of the lack of access to ECL services. In your opinion, how does that affect the economy?
Well, a couple of different ways. One is it makes us even more reliant on non-resident labor. About 20% of Alaska's labor force is non-resident. Many sectors of the Alaska economy are finding it increasingly difficult to find the people, all across the economy, to find the people they need to meet their labor force needs. Yet here we have parents who would like to go to work but are unable to. So it's putting a constraint on employers' ability to find the staff that they need. That's probably the most important aspect.
Thank you.
Ask the question again, because there's two parts to it and I've lost my train of thought.
I think you did pretty well there. I got to go back. I'm folding up the questions as I get done. Okay.
Sorry, John.
So, in your opinion, how does it affect the economy overall?
Yeah, well, so it's that economy-wide impact on labor force, but then it's also about the families that aren't able to earn the income they need to enjoy a standard of living that they should have. All of us that have raised families know how challenging it is when you're young, just getting started in careers, and you have kids, how difficult it is to achieve that standard of living that you'd like. If you just can't go to work, or if the wages that you earn when you go to work are no more or actually less than the cost of childcare, what have you gained? So it has this very personal, family level economic consequence, and then it has labor force consequences.
So I'm going to ask a question about school lunch, but school lunch debt. But the first thing I'm going to do is share something a little personal here, which is Trevor talked about school lunch debt and increasing school lunch debt. I am a child that received reduced price lunch all through my elementary ed. From a family of two loving parents. They're still married today. They just celebrated their 47th wedding anniversary. But I am proof that those programs make a difference, because let me tell you, being hungry sucks. And being a kid that got that reduced price lunch, I am grateful for that program. And my parents were working multiple jobs. So I'm living proof that One, that, you know, a good home, a good family, and programs can produce somebody who pays a lot of taxes. And I'm quite sure I've paid that back, and I'm very happy to pay that back. Oh, and to the legislators in the room, I'd be happy to pay more. So, are there facts and figures that discuss the school lunch debt in Alaska, Trevor?
We don't have those, and actually, I believe DEED actually started doing some examination of this and figuring out practice and who does. Actually, just figuring out what people say they're going to do. We're not too sure what they do, but it has piqued our interest. But I also know it's not something we're so much leading. We have a great partnership with the Food Coalition, which is out of the food bank. So we're not the leader of all things. We're just a supporter of a lot of things. So they're leading that, and if you are interested, I would reach out to them. They will help you understand that more.
And one of the things that I think is very interesting about this topic is that we have some schools where we have our Title I schools, and we have schools that, essentially the federal government a couple of years ago, what they did was they said, if you have a certain percentage of kids that qualify for reduced price lunch, we're going to basically provide reduced price lunch for everybody within those schools, right? And then we have schools where we don't meet that threshold. And those are our schools where we're going to really find this problem, where there's extended debt, because we don't have that expansion of reduced price lunch. And as Trevor said, that federal poverty level isn't that high. So it's not just our poorest schools we have to be looking at. We also have to be looking at our gap schools, right, where you don't quite qualify for this increased federal funding. Next question is, do we know how many early educators in the workforce are at or below the poverty level? It sounds like that's one's for you, Jim.
Oh, we know what they make, we know what their average wages are. What we don't know about the workforce is those that might have children or part of what their family situation is, which is what determines where you are on that poverty scale. So I think that in general, if you look at the average annual earnings of the typical early care and learning educator Kirsten, remind me, it's $11 an hour or something is the typical hourly wage. So do the math. If you're able to work a couple thousand hours a year, you're at $20,000, $22,000. So again, is that, the federal poverty line is one thing. Alaska is different because the cost of living is higher, so that national federal income level might not have quite the same message as it might otherwise. But suffice to say that we don't pay our early care and learning educators enough to provide it's not a living wage, I guess is the upshot.
So I've received a note in addition to a question that says, not sure if you know, but the Anchorage School District provides lunch for all students regardless if they owe or have no money. So thank you, Anchorage School District, for not being that school district that cuts kids off arbitrarily and capriciously. I'll still mention that results in a cash cost to the school district that affects their budget in the long run, so still an issue. Doesn't mean it's a pass. How can we assess the cost savings in K-12 education when ECL investment is increased? What have other states focused on or found where ECL investment has increased? So we're making these investments, where are they seeing the savings?
So in some of the conversations that I've had, it's actually around special ed. So the whole assessment process, one, when you increase developmental screenings, but you also increase early childhood education, that they saw a decrease in the number of kids having to access special ed or quote unquote qualify and needing that support. And as we know, when a child enters special ed, there's a huge increase cost for that child. That's where they saw most of their cost savings. And then they also just saw decreases in absentees. So they didn't need tutors. They saw a decrease in behavioral issues. So they really set up some good markers and followed kids. And when they saw those decreases, teachers could be teachers and less on the disciplinary and other social issues that they were dealing with.
So thank you, Trevor. For whoever asked that question, if you're really interested in that topic, please come see Thread. We have some information, particularly on the public-private partnership that occurred in Salt Lake City between Goldman Sachs and the local school district, how they were actually able to reduce, I believe by about 80%, the number of kids going into special ed, which then reduced their budget substantially. We've been talking about the economic impacts of ECL for years with little positive movement. How can we change the messaging for better outcomes?
Great question. Not sure I have a good answer. I think we just need to keep at it. It's, you know, we find ourselves in just emerging from recession, major budget challenges facing the state and big political challenges in that regard. I don't know that there's anything different to be done other than just keep at it, keep reminding people about the economic connections, the return on investment, the cost benefit analysis around early care and learning. We just need to keep hammering the point home.
I would love to add to that because I think there's some things we can do. If we think about systems alone, one, we have the Department of Education and Early Development, but if you look at what they classify their role, it's really the Department of Education, and they've been pushing that. So we really need to, on the legislative front, change and make it very clear to the Department of Ed that early childhood development is a part of them, and we need to invest in it. So that's one of the things we can do. Second, we have the early childhood, the AECCC. It's all around early childhood, actually empowering them and making them a true council and committee that's evaluating our state of where we're at, taking this data and making strong recommendations. We need to actually not just say we care about kids, but take the steps forward to do it. So that's one of the things, and the state can be doing that. One of the next things that we can be doing is actually talking to businesses. All this amazing data, businesses know how it's impacting them. Businesses, our chambers need to be going to the legislature and saying, this is what we need to have a strong workforce. Rather than complaining we don't have a strong workforce, actually say what they need for that strong workforce, and that is this early step in. Third, or fourth, I think, don't forget, 2020 census is up. You as organizations and individuals, we need to make sure Alaska's counted. This impacts our overall money in our budget. If we want to be seeing our investment happening, we need to make sure we get our true federal share. We need everybody counted. 0 to 5, most underrepresented in the count, and guess who is number 1? Alaska. Really a key thing. And lastly, we need to start having conversations with our legislature. I will put this out there. They're absolutely correct. We don't have enough funds for everything. So let's quit talking about what we don't have and start talking about what we need to get what we need, which is, let's have conversations about revenue, folks. Let's not beat about around the bush. Let's have conversations about it and create that environment for our legislators to have that conversation. So there's things we can be doing, and I challenge you all to take one or all of them and make them happen.
So someone asked a question, how can I get involved? Did you get what you just needed from Trevor? Because I believe that he just laid it out there for what you can do to get involved, right? Probably don't need to ask that one again. So I think this is actually going to be our last question here, which is, Jim, what's the data dashboard that you mentioned?
This is an online data portal where we have developed, compiled all available data that we can find about at the census area and borough level about the number of kids in care, the number of children at various age levels, the number of kids in care, and wide variety of other things. It's an interactive website. I wish I had the web address right with me, Kirsten. It's connected. Go to Thread's website. You'll see the data dashboard. Anyway, it's a very visually appealing way to see how each borough, each census area stacks up relative to other census areas and boroughs around the state in terms of care, the demand, cost of early care and learning. Again, that's developed about 18 months ago, and we've got new data, so we're busy updating it. Take a look at it, please, and we want to make it as user-friendly and as clear as possible in how we're communicating the data, so we'd certainly welcome feedback from all of you as you have a chance to look at that. This is something we want to be really user-friendly and provide a lot of basic data about early care and learning in each community in the state. So please, feedback welcome on that as well.
All right, wonderful. Any closing comments, gentlemen? Any final questions from the audience? All right, warm round for our guests.